Kenya's teachers have begun accessing medical services under the new Social Health Authority, SHA, marking the official transition from the previous private scheme. On December 1st, 2025, the Teacher Service Commission, TSC, confirmed that over 400,000 teachers have officially moved under the SHA medical cover, replacing the long-standing scheme managed by Mine Kenya, also referenced as MAKL. The transition was preceded by a consultative process involving TSC, teachers' unions, including Kenya National Union of Teachers, NUT, Kenya Union of Post-Primary Education Teachers, CUPIT, and Kenya Union of Special Needs Education Teachers, CUSNET, and SHA leadership. The move comes after repeated complaints from educators about restricted access to hospitals and delayed approvals under Mine Managed Cover. What the new SHA cover offers. Under the SHA Managed Cover, structured under the Public Officers Medical Scheme Fund, POMSF, teachers and their dependents are now entitled to a broader and more comprehensive set of medical benefits. Key improvements include access to a far larger network of facilities. The number of accredited hospitals and clinics has increased from around 800 under Mine to more than 9,000. Some sources mention up to 9,600. Institutions across the country, including public, private, and faith-based facilities. A wide range of covered services, outpatient and inpatient care, dental and optical services, maternity care, emergency services, including road and air evacuation, specialist treatment, overseas treatment, chronic illness care, diagnostics, and more. Inclusion of dependents. Coverage extends to the teacher, their spouse, and children, with some versions of the policy allowing up to 6 dependents. Faster, more efficient claims processing. SHA has said pre-authorization and verification will be digital and quick, improving on delays that affected the prior scheme. According to TSC, data for all teachers have been migrated onto the SHA system to ensure that even those currently admitted in hospital, around 320 teachers, will continue receiving care without interruption. Why the change matters. For many teachers, the switch to SHA represents a potentially major improvement in access and quality of health care. Under the old scheme, access was limited, often only to a handful of clinics, and teachers frequently faced difficulties with referrals and specialized treatment. The broadened hospital network, comprehensive benefit package, and streamlined digital processing are expected to reduce these pains and give teachers and their families a more reliable safety net. Furthermore, the integration into a nationwide public servant medical scheme places teachers alongside other civil servants, aligning their benefits with those of other government employees, which many considered long overdue. What remains to be seen? Despite optimism, some teachers and union representatives had originally voiced reservations about the shift, citing concerns about the reliability of SHA based on criticisms from other civil servants under the scheme. Whether SHA will deliver on its promises, in terms of timely approvals, actual coverage, and quality of care, remains to be tested in practice. Much will depend on the efficiency of implementation, hospital compliance, and adequate funding. The launch of SHA-based medical cover for teachers is a milestone in Kenya's education and public servant welfare landscape. If well implemented, it stands to significantly improve healthcare access and outcomes for thousands of teachers and their families across the country. As the new scheme rolls out, all eyes will be on its performance. For many educators, it offers hope of dependable, comprehensive health care, a key foundation for their well-being and peace of mind.